Thank you.
The speaker for the evening is Dr. Rita Singh. She is currently the Vice President of the Nepalese Society of Implant Dentistry. She served as the President of the Nepal Society of Periodontology and Oral Implantology from the year 2017 to the year 2019. She is the member of Zonta International by empowering women through service and advocacy in Nepal. She is graduated from Bangalore University in India. I welcome Dr. Rita.
Thank you so much, Dr. Puneet. Thank you, Dental Practice, for getting all of us together. And it's really a pleasure to be amongst the celestial speakers of this area. In these very turbid, let's say, very turbulent and tough times, something as simple as communication can easily take up the back seat. We are so the different type of mask, in so many things we get lost, but we know that communication is the cornerstone of the dental practice. And this is the key actually to minimize the effect of the virus on our practices and our patients. If we are not proactive, if we're not responsive enough, and if we are not really sensitive about the emerging concerns of the patients, we may actually fail, through this period. So today I'm going to talk a little bit about the communication, how we can enhance it. And when we talk about communication, we think it's all about talking, but it's more to do with listening, active listening, or listening to understand. And a small incident that I want to narrate here is last month, one of our patients, he's a little bit obsessive, let's say compulsive about his health and hygiene, and he always wanted the first appointments. And of course, after the shutdown period, we were doing that. But one day, it so happened that when he came, there was an emergency patient, and the dentist had to attend, this emergency patient. Now, this patient was really infuriated, and he was boiling and brimming with anger. Now, the front desk people, they knew that he wanted the first appointment, but probably they did not understand why exactly he wanted it. We, in communication, we need to actually be in the patient's shoes, and we have to see, through the patient's eyes. So for somebody who's so obsessive, compulsive about the health and hygiene, it's just impossible for him to understand, what it takes to give time for somebody who's in pain. So while communicating, I think not only that, we don't have one formula fitting for everyone. We have to actually hone our communication skills according to the patient's behaviors as well. And I think especially during these hard times when everybody is so stressful, we have to really give due importance to communication. Now, PPE has a lot of hindrance to communication. When we speak, it's so difficult. It muffles our voice. The the shield, the face shield that we have, it kind of hides our smile, which helps us to connect to the patients. And also the facial expressions, which is such an instinctual way to empathize with the patient, that is also hidden. So all the visual cues are not there. So we have to be very mindful about the communication, because the patient may feel very uncomfortable with somebody who's covered with plastic covers, shields and masks. So maybe this is a time where we need to put that little extra effort to build the rapport, because building rapport is important, and this is the key to the success. And with PPs, it becomes difficult. And like the previous doctors talked about teledentistry, I think teledentistry is one such area where we can try and develop the rapport. Now, if we have the video calls, we can actually talk to our patients like how we used to talk in the pre-COVID areas, without the mask, without the goggles, and connect humanly. So not only we are trying to mitigate the risk infection to our clinics, but I think by doing these different kind of digital platforms, by doing the video calls, we can actually also build a rapport. And even after the PPE, of course, PPE appointments, we can do it. And as we know, words is not all. We have the nonverbal communication, the tone of the voice, the choice of the words, the energy level, all these things will help us to establish a good rapport with our patient, which is even more crucial at these times. Now, a very difficult situation may arise, and I'm sure it has already been there in some of the clinics in this Asia, in South Asia, that somebody in the clinic is tested positive. Now, what do we do? Of course, we have the primary concern is about the team member who is tested positive and quarantined, and in case of any kind of symptoms, the health assistance is required. But what about ensuring the safety of our patients and the other team members? That's also very important. So some questions which are there in the protocol, we can see that we have to always check what is the date of the last contact, how long was the contact, what was the distance of the contact, if they are experiencing any symptoms. So we can go through all this and make sure, and like Dr. Gopi said, if that is the case, we have to do the PCR for the whole team. And I think in this kind of a magnitude of pandemic, we need to be very transparent to our patients. Of course, no one likes to associate their clinic or their office with COVID positive staff or the patient, but we have to have that level of trust and transparency towards them, because if they come to know that our clinic is a vector for the transmission and they were not notified, that's even worse. So it's better to be transparent and tell, and we owe that much to our patients, who trust us so much. So just to sum up, I would say communication is extremely challenging due to the PPEs and all the external factors right now. But then heightened attention to our behavior and compassion is very important. We have to be vigilant about our staff who may test COVID positive, and we have to follow the protocol, and we have to keep our patients and the staff very safe. And proper documentation again is very important. We should have a logbook for the patients, not just coming in, not just the consent forms, but also who are the assistants assisting them, who are the doctors, because if we have it everything there separately, it'll be very useful at the time when we have to do contact tracing. So I would like to leave all of you with one last message, and that would be, how many of us actually thank our patients? Everybody knows dental clinic is not the safest place to be in right now, but a lot of dentists are seeing patients. So these patients who trust you, who really trust you with life, I think it'd be really nice if we thank our patients for that particular day, for that day. And of course, our patients are not going to expect it, but it'll be a nice surprise for them. And I think with this, we can actually bring humanity, to our profession. With this, I would like to hand over to Dr. Puneet.
Thank you, Dr. Rita, for a wonderful presentation and a very important aspect which is often ignored during this, pandemic time when everybody is under stress. That communication is the key to, success. You can easily get through the apprehensions of the patient as well as the doctor himself. Well, there are a few questions for you. First one is that, if a patient turns out to be COVID positive, he is COVID positive, and on teletriaging you found that out, what is your protocol? After how many days do you call him for his dental checkup?
Well, if the patient is positive, COVID positive, I've not had that kind of a situation till now. But I think then we really need to make sure everything is cleared out, and the PCR test after a couple of weeks is also cleared, and the symptoms have completely gone. In fact, it would be better to even talk to the medical professional who's been taking care of the person. I think that would be better. I don't know exactly how many days, but maybe other speakers can enlighten on that.
We will get back to it as soon as we continue. Well, another question is that you talked about consent forms. Now, these consent forms, what is the medical legal relevance? Do they have any significance?
Uh, I have been trying the Dentulu. This is one of the Tele Dentistry platforms, and in that they do have a consent form for Tele Dentistry, because we will be using the information. We may be using it, so because the video calls and the pictures are there. So I think we have to have some kind of a protocol for that, the consent. But I'm not very sure about in this area if we are really doing that. But I think it's high time we also inculcate these into our practice.
Thank you, Dr. Rita. Thank you very much for a wonderful presentation. We will come back to you as we progress.